Hello, my name is Lauren, and today I will be talking about pheochromocytoma. I will be explaining the signs, symptoms, and complications, and the treatment plans in case diagnosed with pheochromocytoma. Pheochromocytoma is a tumor, and it develops in specialized cells. These cells are known as chromatin cells, located in the center of the adrenal gland. These cells produce hormones, primarily adrenaline, also known as epinephrine, and noradrenaline, also known as norepinephrine. These hormones work to fight or flight something that is causing a threat to your body. This will increase your energy to get your heart beating faster and high blood pressure to enhance your other body systems to react quicker to this disease. Make sure you make your appointment. I will give signs, symptoms, and complications, so if you feel any of these later on throughout the discussion, this is what you should look out for. This genetic disorder can cause a risk of developing more tumors that may be cancerous. This involves multiple endocrine neoplasia type 2, von Hippel-Lindau disease, neurofibromatosis type 1. This genetic disorder can cause a risk of developing more tumors that may be cancerous. Multiple endocrine neoplasia type 2 is a disorder that develops the tumors in more than one part of your body's hormone-producing endocrine. Von Hippel-Lindau disease is or can result in many tumor sites that are included in the central nervous system, endocrine system, pancreas, and kidneys. Neurofibromatosis type 1 can also range in tumors of your skin. This can lead to pigmented skin spots and tumors of the optic nerve. Complications that include pheochromocytoma is heart disease, stroke, kidney failure, acute respiratory distress, damage to the nerves and eyes. Pheochromocytoma cancer is very rare. The symptoms of pheochromocytoma will also vary and may start with signs such as high blood pressure, rapid or forceful heartbeat, profound sweating, severe headaches, tremors, paleness in the face, or shortness of breath. All those symptoms above are the most common ones, or those are the most ones that you should look out for. And if you do, of course, have a stroke or kidney failure, report to the hospital or call the paramedics. Your less common signs or symptoms may include anxiety or a sense of doom, abdominal pain, constipation, and weight loss. This is when it's time to see your physician. All of these signs and symptoms may occur and have spells that can range anywhere from 15 to 20 minutes. Your actions may take place every day or less often than usual. Your blood pressure may remain in its normal range or be elevated between your spells. Things that may trigger your pheochromocytoma spells, depending on the severity of your spells that take place from time to time in between each day, may be brought on by physical exertion, anxiety or stress, changes in the body position, bowel movements, labor and delivery. Labor and delivery especially, because this brings on stress to your body. Things other to look at may be foods in high in tyramine. This can also affect the spells because it affects your blood pressure. These types of food are some cheeses, some beers and wines, dried or smoked meats, avocados, bananas, fava beans, pickled fish, and sauerkraut or knicky. Try to stay away from these foods as much as you can, or eat as less of them as you can, because this elevates your blood pressure, and this can also trigger your spells. This is a picture of a canine adrenal gland. This is what pheochromocytoma affects. Testing may be done when you explain to your doctor signs and symptoms that may have to do with pheochromocytoma. The treatment process may vary depending on the severity of your condition. The doctor will do a number of tests. He may order a 24-hour urine test and a blood test. Imaging testing may be done to indicate the possibility of a pheochromocytoma or a paraganglioma. Paraganglioma is when the pheochromocytoma has sat for a long time and turned into something else, which could turn cancerous. Computerized tomography, magnetic resonance imaging could be done. Positron emission tomography will also be done. Another one that is very important is genetic testing to determine if a pheochromocytoma is related to an inherited disorder. Your treatment, when diagnosed with pheochromocytoma, is for the tumor to be removed surgically. You will be placed on beta blockers, alpha blockers. This would help your heart vessels open and relax. If you don't get treatment, pheochromocytoma, you can do permanent damage to your heart. This could also cause diabetes. Pheochromocytoma that has developed outside of the adrenal glands is called paraganglioma. This is the stage that will possibly lead or turn into cancer. When the tumor is benign, the tumor is also removed. Small incisions and instruments will be used to do the procedure. Sometimes the adrenal gland is also removed in this process. Before the surgery is done, medication will be given to make sure that your blood pressure is brought down. The medication that is used to help the blood pressure is phenylaxbenzoamine and is followed by beta-blocking antihypertensive agents. The blood vessels that may be feeding the tumor will also be destroyed by the radiation. At this time, there is also no known prevention method to help decrease the chances of you developing pheochromocytoma. Many specialists have done research upon pheochromocytoma, and what they have gotten, and that perhaps other than anything else, has been through genetics. This is a picture of them surgically removing the benign tumor or tumor that has turned into paraganglioma. My references are https://healthy.kaisepermanente.org, http://www.mayoclinic.org/diseases-conditions, or http www.ncbi.lmm.nih.gov. If you have any concerns with your complications, signs, or symptoms, make sure you follow up with your doctor, and I hope I helped you. Thank you.